So in our last module, Module 8, we're going to talk about couples, family, and group therapy. So we're going to move beyond the individual one-to-one kind of classic therapy and look at more specific viewpoints there. And that's going to go ahead and wrap up our Chapter 3 on treatments of psychological disorders. So let's look at first couples therapy. This is sometimes referred to as marital therapy or marriage counseling. And what it involves is seeing intimate partners together in therapy with the goal of improving the relationship together. Okay, so it's really not improving the individual per se, but more that the couple or the relationship is enhanced. So to do that, they want to focus on resolving conflicts and promoting mutual satisfaction by improving the way that they're communicating and negotiating, and also the conflict resolution skills that are endemic within the couple there. And so there is that negotiating, give and take that needs to be there. And there are a couple of things that you certainly need. One of them is politeness. So it is an essential component when you effectively negotiate by allowing you to select clear ground rules that are going to facilitate polite communication. Because once the communication becomes heated or emotional, then usually logic goes out the window and usually you see the issue spiral. Now, you can use couples therapy to treat specific disorders as a supplement or an alternative to individual therapy, but really the focus is on relationship enhancement. The research on it is a little bit mixed, so it really depends. If you're really fascinated by couples therapy, I encourage you to look at the research by Gottman, and he has identified what he called the 4 horsemen of the apocalypse in whether couples relationships are doomed or not. And surprisingly, the heatedness of an argument is not a good predictor. Usually it's the ignoring or distancing or walking away is a much more troubling aspect. So that's Gottman, Gottman, if you're curious. So that's couples therapy. Now, if we move on to family therapy, that is similar to couples therapy. It is relationship oriented, but in this case, of course, it contains family members, usually 2 or more family members, generally includes children. So you're going to have, as you might imagine, if you did family therapy with all adults, it could get kind of chaotic. But with the children, those are very tight-knit units typically. And the goal is really to hopefully improve family relationships or the problem-solving skills that are used within the family, or helping the family cope with psychopathology of a family member. So we will be getting in, or we talked a little bit about the rates of various disorders and how many people experience them. Very high odds within families that you probably have at least a quarter of all families that have individuals that are dealing with psychopathology. And so a lot of families need some assistance in learning how to deal with that. And the family therapy can be an effective approach. Now, there are a lot of different styles of family therapy. Most, though, are going to share this kind of systemic approach. In other words, the individual is a part of an overall family system. And so the emphasis is not on the individual and individual change, but in other words, understanding how the system works with its family members' interdependence and alliances and expectations. And the common goal here is really to strengthen the alliance between parents or get parents to work together and not against each other. And so you can imagine trying to get 2 people to work with one another. It's always a challenge. Now you have them in an intimate relationship with each other, but also among their children. And there can be a lot of stressors there. So that's what the focus on family therapy is. And then moving on to group therapy, this can involve anywhere from just a few to a lot of members. And there's different types of groups, almost too many. You have your psychoeducational groups, and these are really designed to teach group members very specific skills or information that can be relevant to their psychological well-being. One of the ones I can think of is like a parenting group is a very common type of psychoeducational group because there are a lot of new parents out there that are struggling. Maybe they didn't have good role models growing up, and so they're not really confident in their own parenting skills. A psychoeducational group can be quite effective, and I've actually gone to talk to a few of those over the years to really try to help them out and understand what children are going through and good ways of approaching things like discipline and problematic behavior. Experiential group therapy, this is where the relationships are the primary mode of treatment. So it's interpersonal interaction and relationships among the group members, and they form these, and that's going to be the primary component of treatment. So it's really kind of focused on this kind of social support and coming together for each other. And the last type of group, and probably the most common, is the self-help group. And so these are people who are going to share common problems and share information and experiences and really trying to seek out help and get personal growth. I would say the most famous is Alcoholics Anonymous is a self-help group, but there are a ton of other ones out there, and they usually meet on a regular basis and hopefully help people process things. Now, I should back up and say as a whole, why do we even look at group therapies? Well, one of the reasons is there is a lot less expense in group therapy because usually you only need one facilitator. And in self-help groups, you don't need any professionals at all. Those are just kind of self-governed. And so the expense is certainly an issue. You can, of course, impact a lot more people in it with the same resources, and that the groups can rely on each other a lot of times and provide social support, especially if you have the same members coming back again and again. So it's an effective approach. A lot of times you'll see people go from individual therapy into more of a group therapeutic setting as they make progress. They don't need as much of the individual processing, but rather still just need a general support system and people who understand what they're going through. So, all right, you made it. So that's chapter 3 on treatments of psychological disorders. We went over a lot of different stuff. And as I said at the beginning of this chapter, these are going to be components that come up again and again and again throughout the rest of our chapters as we begin discussing more individual disorders. So we're not going to probably go into as much detail as we did in this chapter on the individual approaches because, of course, the focus is on the disorder. So you may want to come back to the notes that you took for this chapter just to reacquaint yourself and to remind yourself what these approaches are like because it can get confusing, especially if you're just starting out. I even have trouble tracking all the different approaches. And, of course, I've been doing this for quite a long time. So give yourself a little bit of break and refresh yourself over the semester with these, and you'll soon be able to identify them pretty readily. All right, so we're going to tackle chapter 4 next, and stay tuned for that one.